So hello everyone, I am Sakshi Chirania, a final year medical student at Kasturba Medical College, Mangalore, and today we are sitting in surgery department at KMC with a very renowned professor and surgeon, Dr. Sriram Bhat sir. We are honored to have you, sir.
Thank you, Sakshi.
So sir, we have two sets of students with us. One who will be facing the battle in almost 45 to 50 days, and the other batch of students who have just started with the final year journey. So the first question I want to ask you, as the exams are 45 days away and we have 11 subjects with us, so the panic has set in. So what would your advice will be for those students who are panicking at this moment, and how should they revise productively in last 45 days, including surgery?
Thank you, Sakshi, but it's a good question. And you have a lot of 11 subjects are there, you are telling.
Sir.
And you're split actually. And each subject, because major subjects are surgery, medicine, gynec, OBG. Then of course ENT, also come, and other subjects also there. Smaller subjects, of course pediatrics is separate now, big subject.
Yes.
So orthopedic, other subjects also you have to read. So concentrate on the major subject. What is difficult, it is logically understood that by now you have read everything. Truthfully actually should be like this. And it's the only preparation. You will be knowing, you will have the gross idea about the subject. Now make a point that which is difficult for you people. Difficult things to remember, recapitulate, recall, those you have to mark it out. So near the exam to concentrate on that, and other things just brush up, because already you have read, it's supposed to be your read, and those things you just recollect, that is sufficient. So mark the topics which are difficult, segregate. This is easier, I can recollect anytime.
Yes.
This is one brush up is required. This is concentrated look is required. Like that you have to segregate. And ideally you should go through the last 10 years question paper. It is called the bird's eye view. So that grossly you should have the idea how exactly questions are asked. If you go through the 10 years question paper, usually 70-80% of questions will be covered with that. So same questions are repeated or similar questions with same answers. Recollect and recapitulate and answer that, because it is impossible to read, especially surgery previous day.
Sir, also I have heard that in KMC usually students are failed in surgery subject specifically. So there is this fear among the students that about surgery specifically.
No. I don't think it is not so. Passing is easier, failing is difficult. Usually students fail on their own, not by teachers. Teachers won't fail. When you take class, we shout at students, everything, they comment. We love our student from the heart actually, that is there. We always express that they should do well. So exam is a different thing, our emotion is a different thing. Exam is a protocol, it's like this. It is an evaluation. So failing is difficult in current this one, because you have got oxy and other things.
Yes.
Mainly theory because 2-3 exams are correcting the paper. So theory, if you don't write, you won't pass. So mainly most of the people are failing in theory. Practical, reasonably whatever we have taught, way of writing case sheet and reasonable presentation, we definitely. So in the UG exam, practical side, we will never look at what you don't know. Basic thing you know, and we want to know what you know. What you don't know, we are not interested. We will not penalize. We will ask question, further things, but basic things you have to know. But it is difficult to fail actually in a practical exam, actually, the current thing. So it should not be panic at all, there is no such things. Theory, it is individual knowledge, you have to read. So how you write, this is important. You write point wise, don't write what you don't know. Because our brain is teachers, faculty, the moment you write wrong thing, we pick up that one very fast. Okay, so we will immediately focus on that. So whatever you know, you write. It is not necessary you write whatever you know, everything should be written. Answer to the specific point.
Should we write in point wise or paragraph?
Point wise with some diagram. Proper diagram definitely is a very catchy. So immediately we'll get appeal that with that, and we'll give the mark. And handwriting, yes, but we will never penalize bad handwriting. Understood? It will never. My handwriting is bad. I never had any problem. So it is the content which is important rather than only handwriting. Okay, but proper writing, legible writing, content. We look into the content. We assess the content. Don't think that we don't read. We read. We go through the content and then give the mark. Most of the examiners. They are truthful. Okay.
Yes, sir. Sir, your book is very much famous among all undergraduates for the clinical aspect of it. So, in exam hall, if we are standing in front of a long major case and it's a very scary and nervous moment for us, so what should they must know that in clinical examination they have to do this?
The basic clinical examination they have to know. Spelling examination methods. If they ask fluctuation, how to do. If they ask you to demonstrate tonsillination, mobility, and like example, I'm just telling example.
Okay.
Similarly, of course, swelling, breast lump, thyroid, artery disease, perivascular disease,
Hernia.
varicose vein, then soft tissue swellings, hernia, hydrocele short case, and some swelling ulcers. Only these are the cases will be kept in your exam. Few are long case, few are short cases. Proper clinical examination is very important. This is what you will concentrate. Each point examination, you are supposed to know, you are supposed to demonstrate, and of course diagnosis usually we will not penalize if you won't give diagnosis, especially in the abdomen mass. There is a long case.
Yes.
You tell this is liver and give features why it is liver. That point is important. As UG we will not penalize. PG yes. But you should justify why it is so, what are the features, clinical features. Your clinical findings should be correct, and how to examine a patient, methodology,
Yes.
basics. VSS basics, we will never go into the depth of subject knowledge for UGs.
And also, like, we all watch SRB sir's video on YouTube for the clinical assessment. It's very good. Like, all the videos are very helpful in case presentation. Sir, as we are talking about the practical exam for Viva, if someone wants to ace the Viva and if they don't know any answer to examiner specific question, then how should they manage if they don't know any specific answer to the question?
Right, most of the time basic question ask, then if you are good, once you finish your basic, you will go a little higher, further level, management, evaluation. There also if you do well, then further will go. So step by step. If you don't know the answer, we'll give clue. Usually we'll give this is like this. If you don't know the answer, tell, sir, I have read, I forgotten, I can't recollect.
Okay.
Will definitely, because subject is whether it is medicine, surgery, gynec. Surgery is so vast.
Yes.
Even I have written a book. Even then I may not be able to recollect and answer somebody. Suddenly somebody asks. It is impossible. We will never penalize for just not answering one question. Other than basics, our major thing is basics. Anything else is step up. If you don't know, tell I don't know, I can't tell I have read, sir, I can't recollect. Be honest. Nobody will penalize. We are very flexible in that. Not only me, most of the exams are flexible. But we will give some clue. Then if it is so, tell if you don't know, we will go to the next question.
Yes.
Okay, we will not. Personally, I will not. I will not penalize. Most of the examiners will not. They may question,
Yes.
they may make some comment. But it will not trouble you in the passing. But failing in the clinical side happens when you don't examine, when you don't write the case sheet properly. That's why I have been insisting, you might have seen.
Yes, sir.
Write case sheet properly, That is the basic thing. Help you or save you from getting troubled. Once you have written, you can't deny it. It is written. Even if you grumble in presenting, it is written there. After the internal exam, he has written it.
Yes.
So writing case sheet properly in detail, I have been insisting in the very clinical, I insist. That will definitely useful, and if somebody is writing case sheet in detail properly, moment you see that, they will be very happy. Then nobody will tend to fail them.
Yes.
The case sheet makes a lot of difference. So writing proper case sheet, complete case sheet, that will definitely sail through the exam.
So coming to the other group of students who have just started their final year journey, so what advice will you give them to study surgery from day one so that they don't just memorize but they also learn surgery?
That's what. Wherever possible, go and see patients. The seeing patient, examining patient is the most crucial thing. We got a lot of time. Then applying, where finding is correct or not, parallelly read clinical book and manual. See a patient, examination, same thing, read. Then again you can see the patient, then whether it's okay or not, your examination, where you have gone wrong, how exactly it is wrong, whether this is the method is correct or not. Thinking for this. And eventually, once you start doing that, start drawing the
Diagram.
finding. That's important. Diagram expresses everything. So surgery should be learned daily. It is application, it is analysis. That imagination is most important than imaging. Imaging is only supportive. It's imagination. The brain should continuously think. During rounds, I will tell PG, use your brain rather than ultrasound. It's a thinking, it's analysis, which is important. That they have got a time now, near 1 year, so they can incultivate those things. So by seeing patient, if they can discuss with us, so no problem with us. But they should come forward and discuss. They got enough time. They can go through the question paper now. How theories are asked, questions are asked, how practical questions may be, everything. They got enough time. It should be continuous process. Not like T20 or one-day match. It's a test match, test series. Keep on doing it. It's not one day. I am interested today, tomorrow. Enough is enough. Your interest should be continuous. It is not a short-term interest.
So, sir, if I may ask you, what is your favorite memory from teaching in Kasturba Medical College, Mangalore?
Nearly 36 years I have been teaching. Mainly students, teaching students. Specifically undergraduate, I'm not against postgraduate. Before 2010, final year students, no morning theory class. So last 6 months is only dedicated to the clinical side. So until 2010, I used to come 7:30 morning. I used to call all students who are interested, my unit of course. I'll give cases, 2 cases I used to give. So I've been doing that one for 10 years. Then new things have come, mobile has come, Google has come, everything. Students also slowly deviated from us. That was the very, very frank memory. For 15 years I did that. 10-15 year batches. They still remember me because of that. And because of that I could upgrade my knowledge. That is the most important thing. I could do the re-editing of my book. If you teach somebody, you will learn more.
Yes,
your thinking process will increase.
Wrapping this discussion, sir, I want to ask one last question. What advice you will give, or what wishes you will give to the final year students who will be giving 11 subjects?
I hope they have read everything. They will do well. Let them not panic, because examiners are not any villains. We are to pass you people. We know you people, because the subject are very vast. You are learning only basic thing. Frankly, to learn surgery, I took around 20 years. Because to understand in depth and have the very grip of the surgery. Basics, few cases properly, applications. Be bold, be confident yourself. Final MBBS exam is not a terror exam, nothing to worry. Not very terror, like CA exam is very difficult. Certain other IAS exam is very difficult. Not like that. It is not that much terrorizing. But basic knowledge, that be sufficient enough to pull through the exam with rather not just passing, with a good mark, with a comfortable mark, with a dividend, definitely. So all of you will do well. Don't be panic. My wishes, rather my affectionate wishes to all students. Basically, we love our students. We will never crave right through anybody. So do well. Final year exam going students. Best of luck.
Thank you, sir.
And hope everybody will do well. And thank you for calling me and giving a small, allowing me to request me to a small
Thank you,
opinion
sir,
from my side. Okay.
Thank you so much, sir,
thank you,
for
sir.
this thing.
Thank you, Sakshi. Thank you, everybody.
I thank Dr. SRB sir for guiding us, and all the students who are watching this, please remember what sir said. Thank you.